Well, we begin with the so-called Gang of Six. These are the senators who may decide the future of health care reform and where this debate heads. After weeks of stalled negotiations, testy town halls, they got together for a late-night meeting of the minds. Did anything get accomplished? Savannah Guthrie has the details of that conference call from the White House. Hi, Savannah.
Hey, Dylan. Yeah, the Gang of Six got on the phone about 9 o'clock last night and spent more than an hour talking. And what came out of it is a commitment from them to keep on working. They still think they can get a bipartisan deal, but frankly, hopes for that are dimming. Here's the statement from the chairman of the Finance Committee, Senator Max Baucus, the Democrat of Montana. He said, quote, "As we travel our states, our work on health care reform continues. Tonight was a productive conversation. We discussed our progress and remain committed to continuing our path toward a bipartisan health care reform bill. Our discussion included an increased emphasis on affordability and reducing costs, and our efforts moving forward will reflect that focus, a signal perhaps that they may try to scale down their efforts and try to take away some of the costs. Health care reform estimated to cost about $1 trillion, so they may try to scale that back. In the meantime, we saw the president out in front and center yesterday in a couple of different forums. He had a radio show live from the White House yesterday with conservative, some say conservative, talk show host Michael Smerconish, and he really took on Republican opposition to health care reform in a more explicit way than we've really heard before. Listen.
I think early on a decision was made by the Republican leadership that said, look, let's not give him a victory, and maybe we can have a replay of 1993-94 when Clinton came in. He failed on health care, and then we won in the midterm elections, and we got the majority. And I think there's some folks who are taking a page out of that playbook.
Republicans, of course, have a different view, as you may expect. They say it's the president who never really took their ideas seriously. And I should mention, by the way, Smerconish is a Republican, but he voted for Obama. And now let's just show you the latest poll. This is the Washington Post ABC News poll, and it really shows the political price the president has paid for waging into such a high-stakes battle. The confidence on Obama to make the right decisions, this poll shows it is now at 49%. At the 100-day mark of the administration, it was 60%, so a significant hit there. And then finally, Dylan, on the agenda today, the president will meet with former Senate Majority Leader Tom Daschle, the man who was supposed to lead health care reform here at the White House, but of course had to drop that nomination because of tax problems. But he'll be here, presumably, to talk legislative strategy. Dylan?
All right, Savannah, thank you. Jonathan Capehart, Karen Finney with us today out of Washington, D.C. Also joining us right now, Michael Smerconish, who interviewed the president, as Savannah just described, only a few hours ago. Michael, welcome to the program. How did your audience respond to the interview?
My audience was generally appreciative of the opportunity, Dylan. First of all, the calls that came, and they were fast and furious, as you might imagine, were all very respectful. I really try and have a dialogue on my program. Mine is not a shout fest, and I think that they appreciated the opportunity that several of them had the chance to pose their questions with no restrictions, with no ground rules to the president. Of course, I wish I could have posed more questions, but we did the best that we could with a short period of time.
The most burning question you still have?
Well, mine was a philosophical question, not necessarily from me, but on behalf of the audience that I was anxious to put to the president, and it's this. It's the bigness concern. It's the federal government involvement in cars, in banks, and potentially in health care. And I'm not talking about the birthers. I'm not talking about fringe folks. I mean, many of us who are centrists are concerned that the government has taken on too much, and I wanted the president to have the opportunity to respond to this mindset that says he wants to be in all aspects of your life. And I thought he provided an effective answer to that issue, where he said, it didn't begin on my watch. I never wanted to be in the banking industry. I never wanted the federal government to be so involved in the automotive industry either. So, you know, I thought that he provided a pretty good reply. Did
he give you any indications? You know, I want to bring Jonathan and Karen into this conversation. How are you interpreting the body language as we now set up for September, Karen? In other words, how much sort of the the carrying on, if you will, can be tolerated between now and September?
Sure. Well, August is always this month where I feel like in Washington we think it's going to be calm and it never is. There is a little bit of a political calculation, though, that says in August you can kind of let things get a little bit out there because, look, in September, as you know, Congress comes back, kids go back to school, people come back and really start to focus. And so that's when I think the debate is really going to intensify again. But that's also going to be when the administration is really going to have to be winning the message war. Certainly there have been some missteps along the way. I'd be one of the first to admit that. August has been difficult. I think the last couple of weeks they've really seen sort of where those fault lines are between the support for the public option and sort of where some of those folks who oppose it is. But again, going into September, they have a little bit more time to kind of, get it together. But September's really going to be critical.
I want to bring in the bullet points that the president spelled out in Michael's interview yesterday as it pertains to health care. And then, Jonathan, why don't you give me a reaction to this and then basically how much he has had to change his message as August has evolved. But again, this is the president to Michael yesterday on health care. 1, he says it must be paid for. 2, must control costs. 3, must help people already insured. 4, must provide options. Those are not the talking points that he led with. Those are the talking points that he offered up yesterday. Fairly vague in a couple of categories. How do you interpret that, Jonathan?
Well, you know what? Those broad outlines, those points have always been a part of the president's message. I think the problem has been he hasn't been specific. You touched on it just now. Because there haven't been any specifics on any of those points, he's allowed the Republicans to define what those things mean for him. And I think that come September, the president and the administration will have to get a whole lot more specific than it already has been on what exactly it wants. If it wants to control the message.
I don't totally agree with Jonathan on that. Again, I agree that in the beginning the sort of broad outlines was problematic and they probably should have been more specific. But I think in September they need to focus on a couple of specific big ideas in terms of cost containment. Again, this focus on the insurance companies instead of talking about this bigger idea of health care reform. It's really health insurance reform that we're talking about. So I think fine-tuning the message and focusing again and again and again on those points in September will be important. I don't know that he needs to get down into the nitty-gritty of the sausage making, though. I don't think that's helpful.
Well, I think if he wants to get a bill passed and control the message, he's going to have to get a whole lot more specific.
Michael, that has been one of the big criticisms. When you spoke with him yesterday, what was your sense, and did you get any direct or indirect sense on the radio or off camera, for that matter, from the president about how he views his role in defining the message on health care going into September?
Well, Dylan, I think that he fully recognizes that because they've lacked specificity, they've been behind the curve with a lot of things that have been said about this bill that are factually inaccurate. I mean, what he said to me at the outset was, I'm thrilled to be here, and I'm hopeful, I'm paraphrasing, but I'm hopeful we can bury some of the urban legend and lore that surround my plans. Illegal immigration and what happens to illegals relative to the new health care plan was one example, for example, that he tried to say, hey, it's not the way it's being spun. So I think they recognize this issue, and this was a small step they tried to use.
Michael, congrats on a great interview, and it's rare that you get to do a radio interview that's carried on 3 cable networks. It was brilliant on your part. Well done. Jonathan, Karen, sticking with us. Michael, enjoy your weekend.